Hello and welcome to Bariatric and Metabolic Center, a center for health and wellness here at Coffee Regional Medical Center. If you're watching this, it's because you're interested in making a lifestyle change. You've reached a point where you can say, enough is enough. I want my life back. You've tried to lose weight, but some support along the way would help. You've taken the first step. We are excited to welcome you. My name is Shay Edwards. I am the medical assistant here at Bariatric and Metabolic Center, and we are excited to start this journey with you.
Coffee Regional Medical Center established our bariatric service line in collaboration with Emory Healthcare in Atlanta. As an Emory Healthcare service affiliate, we're able to provide our patients with easy access to the Emory Bariatric Center. Bariatric and Metabolic Center opened in Douglas in October 2020. Through the invaluable partnership, we're able to provide telemed opportunities with the surgeons on complex cases.
Hi, my name is Megan and I'm the nurse navigator here at Bariatric and Metabolic Center. I, along with many others, will walk with you throughout the entire process. Here at Bariatric and Metabolic Center, we provide you with all the tools necessary to be successful after surgery. We hold support groups every 8 weeks, and we're here to assist you with any questions you may have throughout your journey. The first step as a patient is to call your insurance company. You want to find out if bariatrics is covered under your plan and what the plan requirements are. As a center, our criteria for bariatrics is a BMI of 35 to 55 for males and 35 to 60 for females. If your BMI falls between 35 and 40, you must have a comorbidity.
My name is Bonnie Whitfield, and I am the registered dietitian working at the Bariatric and Metabolic Center in Douglas, Georgia. I've worked in the world of weight loss for several years, and I am looking forward to supporting you along your journey. We incorporate protein, carbohydrate, and fat into the diet. We encourage the use of measuring devices such as tablespoons and measuring cups to assist in your portion control. Due to reduced volume and food intake, we also supply you with vitamins and minerals to prevent any nutrient deficiencies.
Hi, I'm Caroline, a physician assistant here at the Bariatric and Metabolic Center in Douglas, Georgia. I've been involved in bariatrics for years, and I take pride in helping patients to reach their health goals. Let me tell you a little bit more about bariatric surgery so you can decide if this is something you'd like to explore further. Bariatric surgery has been around for decades. What used to require a huge abdominal incision with a lengthy hospital stay can now be completed in a minimally invasive technique requiring just a few small incisions and an overnight hospital stay. Bariatric surgery, like any other surgery, is not without risk, but thanks to surgical advancements, it is now a common and safe procedure. The sleeve gastrectomy, frequently referred to as the sleeve, has been commonly performed as a weight loss procedure since 1999. As you can see in the image here, we permanently reduce the size of the stomach to nearly 1/4 of its original size. This is achieved in a laparoscopic approach. Several small incisions are made across the upper portion of the abdomen. Typically there are 4 to 5 incisions, but depending on a person's anatomy and previous surgical history, this could vary slightly. Once the surgical instruments have been placed through the incisions, the blood vessels along the outer portion of the stomach are removed carefully using a vessel sealing device. A sizing tube is then placed into the stomach through the esophagus to serve as a stapling guide. A special stapler is then used to remove the excess portion of the stomach. Once the excess portion has been fully detached from the remaining stomach, it is removed from the abdomen permanently. The result is a much smaller, tubular-shaped pouch, similar in shape and size to a banana. Having a smaller stomach reduces the volume of food that can be eaten. In addition to gastric restriction, the sleeve provides some degree of hormonal appetite suppression. These two components work in tandem to yield weight loss. The gastric bypass was initially performed as a procedure for weight loss in 1967. Over the last 50 years, this procedure has been improved and perfected significantly. As you can see in the image, The stomach is divided using a series of staple lines. The gastric pouch is created from a small portion of the stomach and then connected to the small intestine, bypassing the proximal portion of the small bowel. The native stomach is left intact in the abdomen. This procedure is considered both restrictive and malabsorptive. Like the sleeve, restriction occurs by reducing the volume of food a person can eat at one sitting. Malabsorption occurs by decreasing the transit time of food through the digestive tract by bypassing the proximal portion of the small bowel. Bariatric surgery is just a tool to help you lose weight. It is not a quick or easy fix to a chronic problem. You will still have to make lifestyle and diet modifications to ensure long-term success. But the good news is, if you adhere to our post-surgical nutrition and lifestyle plan, the results can be life-changing. Weight loss improves and in some cases resolves health conditions such as hypertension, diabetes, sleep apnea, gastroesophageal reflux disease, and chronic joint pain.
Coffee Regional Medical Center strives to provide health care close to home. Coming back home and establishing practice, I've noticed a need for this in our community. Many patients struggle with weight loss. They don't know where to go or where to turn. They've tried diets, tried exercise, and nothing works. And for this option, I'm proud to be able to offer this through Emory Healthcare and Coffee Regional Medical Center. Surgery is not for everybody, but the ones that are, I'm glad to be here for them.
We realize that your time is very valuable, so we thank you for taking the time to watch our online seminar. Please carefully consider your options and let us know if you would like to schedule an appointment to learn more.